This podcast is Module 13, the concept of mobility, focusing on the musculoskeletal assessment. Here are your learning outcomes. So this is just basically about mobility. Make sure you're reviewing your A&P as it relates to the musculoskeletal system. It's going to include muscles, ligaments, tendons, cartilage. Some lifespan considerations. Bones and muscles adapt with aging. There are some bones that do fuse during infancy. Bones in children grow as the child ages. The growth ability is turned off as adults. Bones undergo remodeling. This is the process of remodeling includes like bone resorption, where the bone is broken down and minerals are released into the blood. This is very important for bone repair and calcium regulation. Older adults experience physiological changes that decrease strength and mobility. Changes in older adults. Normal bone changes, there's going to be a decrease in bone density. Spinal discs are going to lose their fluid and become thinner, and both of these result in a shorter stature and stooped posture. That's why often older adults have lost some height also. So normal muscle changes, muscle fibers atrophy, they become less elastic, have less tone, decreased speed and power of contraction, so there is decreased strength, slower reaction time, more rapid tiring, impaired balance, increased falls. Ligaments and tendons decrease with elasticity, strength, hydration, they tear easily, they heal more slowly, and also they decrease flexibility and range of motion. Musculoskeletal system affects nearly every aspect of life. Alterations in muscles, bones, and joints are linked with a variety of health problems, arthritis, fractures, neurologic disorders such as Parkinson's disease, traumatic injuries. So alterations in mobility. The first one is back problems, and we're going to cover this in class. So herniated disc and scoliosis we're going to cover in class. I'm going to post the PowerPoints online, so look through them, make any notes, and we'll discuss herniated discs and scoliosis in class. The rest of these you will get in other courses. Next semester we are talking about MS and I don't remember what else. But these other disease processes that affect mobility you will be getting in other semesters. Non-modifiable risk factors. Aging is a primary risk factor. Joint problems decrease mobility. Things such as osteoarthritis, gout, kyphosis is a hunchback, lower back pain, inflammatory disorders, risk of fractures, genetic factors. Some modifiable risk factors, the biggest one being obesity. The excess weight does put strain on joints. It increases the destruction rate of the cartilage and other tissue, and when that cartilage is damaged, you have bone on bone, and that's very painful and does hinder mobility. Well-balanced diet, weight-bearing exercises are going to promote bone remodeling. So subjective data. Health history. What types of questions are you going to ask? Musculoskeletal dysfunction. Are they having any new problems with mobility? Do they have pain, fatigue, any weight changes, inflammation, any past injuries, onset, severity, and timing of any mobility problem? Objective assessment. Please bring your musculoskeletal practice rubric to class. We're going to go over that. So we're going to inspect and palpate bones, muscles, and joints for any deformities, any tenderness, any pain, And we're also going to be assessing range of motion. We are going to be, I know that in the lab you are doing complete range of motion and you're being tested off on that. So I'll explain how we're going to modify that a little bit in 142. This picture is interesting in that you need to make sure that you are looking at the spine, making sure that the head is erect, that the spine is straight. And this is a good photo with the lines on it that indicate that the scapula and the iliac crest are not level. So there is a curvature of the spine. These are the landmarks that we're going to be looking for when we look at the spine for scoliosis. The five P's of neurovascular assessment: pain, pulses, pallor, skin color, paresthesia, that's your numbness, tingling, or burning, paralysis or paresis, or which is partial paralysis. An example of this is where you have a fracture, maybe of the radius, and you want to make sure that you're assessing the fingers. Lifespan, cultural considerations. Typically, there are genetic disorders or congenital malformations in infants and children. When they get a little bit older, children and adults are prone to trauma from sports, abuse, or accidents. Older adults are more prone to inflammatory and wear and tear problems on their joints, again, where that cartilage wears out. Pregnant women have a decreased range of motion and increased back pain. And this is your simple documentation. So again, bring your practice rubric for the musculoskeletal assessment, and we will be covering back problems of herniated discs and scoliosis in class.